Hi, I'm Kathy B. from YourHealthUpdates.com, and I'm here again with Dr. Matthew Rowe, an upper cervical chiropractor, and he's already done a little scan on my neck and determined that I'm a little off kilter. So he's going to demonstrate how he's going to repair that for me. So, I'm all yours.
We got to get your head on straight.
I've heard that before.
What we're going to have you do is you're just going to have a seat right here.
Okay.
In a second, we're going to lie you over onto your left side. Your head's going to go on this pillow right here.
Okay.
Your feet are going to go up down here at the end. So you're going to be laying on your side kind of like you're taking a nap.
Okay.
The reason we lay you like this is because it's going to allow you to be in the most relaxed position. And I remember me telling you the other day, we don't do any twisting and turning. Okay? We use very, very gentle techniques.
Right.
In fact, I use a little instrument that has a dial on it that gives me an angle, and all we're going to do is just tap the bones back into place. So you're not going to feel anything at all.
Okay.
All right?
I can deal with that.
All right. So based on the x-rays, based on your posture analysis we did, and based on the heat scans that we did, we know that you're subluxated. You have an upper cervical misalignment. Okay? To the point where it is causing pressure because we saw the red on that graph.
Right, I remember that.
What we want to do is we want to see if we can unlock that area, and we want to get the red to turn to green. If we can do that, we can get your body functioning and actually healing, which is exciting because many people don't ever go through a healing process, and we want that for every patient.
Yeah, I know for me, I just think a lot of things is part of the aging process, and you just live with it. So
that could be one of the biggest misnomers, and that's one of the things that we as upper cervical chiropractors have to battle every day. Is we're designed to live to about 100, 120 years. We just do things along the way to mess it up.
Yeah.
So, all right, let's get you on your side over here. Place your head right here. Feet, good. Okay. So I'm just going to move your head right there. Okay, this headpiece moves up and down a little bit, so it's going to allow you to get in a nice, comfortable position.
Okay.
Okay, so we're just going to turn your head like that. Perfect. Now from these x-rays, it gives me a three-dimensional view, so we know exactly how far these bones have moved. So what I do is I take a little measurement here, and it gives me an angle, okay? So we know exactly which way to come in and correct that subluxation.
Okay.
And then I take my scary drill here.
Let's see.
It's not really that scary.
Oh, yes, it is.
What we do is we just set the angle on here, and all you're going to feel is a slight tap. Do you think you can handle that?
Did you just tap it?
That was it.
I didn't even feel it.
Good. So let's put your head back here.
Okay.
Good. And I'm just going to come in right behind the ear here, and all you're going to feel is a slight tap. You feel that? Is that okay?
I hardly felt it.
Good. And that's it.
Are you serious?
That's all it takes.
I really didn't even feel that.
That's the magic of it. That's the beauty. Come on up.
Okay. All right, we'll see.
Okay. So now what we would do is we'd actually want to have you come back and rest in our healing room.
Okay.
And the reason we rest you is because we want to allow the messages from the brain to send through that brainstem area down into the body. It allows the muscles to relax and those postural compensations to work their way out.
Okay.
But you're on your way to health and healing.
Very good. All right. Well, thank you very much.
You're welcome.
And we'll be back and let you know the results. Hi, I'm here with Dr. Matthew Rowe, our upper cervical chiropractor, and he just did a correction on me and then sent me to the healing room for a little rest. Oh, and it was wonderful. He's got some great soft music playing in there and a little pillow that keeps my neck in alignment, a little blankie, and it was wonderful. Now he's going to go ahead and scan my neck and see if there's a change from the original scan before the correction. Are you ready?
Ready when you are.
Oh, I'm ready. I'm no chicken anymore. That was great.
Good. Yeah, it's very, very important that we do scans both before and after. And that's really the way that upper cervical chiropractors that utilize the thermography and the heat scans is we want to make sure that we're actually addressing the cause of the problem. If we can get this scan run and see that these colors that we saw on that previous graph clear out, then we know that we've removed the pressure off that brainstem area and that your body's healing and functioning the way it was designed to. Isn't that exciting?
It is exciting, and if I remember correctly, you said the left side was all green, and that's what you wanted to see.
Yes.
But the right side had a little bit of green, a little bit of yellow, and a little bit of red.
Yep, not a little red, a lot of red.
A lot of red, and the red is not good, right?
Red's not good.
Okay, so if I have been corrected correctly, then it should show, is this it?
This is you right now, yes.
Yeah!
So what we see here is from that front view where we're looking at the actual colors, we got a great correction on you. You cleared out perfectly. So
Very
congratulations. What we've got is we've got green up and down. And if you remember from what we were saying earlier, green is normal. Now the pressure's off that brainstem area. So the messages from your brain can flow to your body, and those healing messages can start actually going and then repairing some of the things that we talked about in your consultation.
Well, that's amazing. And one of the things that I really am taking away from this is the fact that I had no symptoms. And so now that I've had this correction made, I'm probably going to start noticing maybe I had a slight headache that I wasn't aware of, or maybe just cognitive ability should be a little better.
Right.
Fantastic.
Yes.
Well, good. So how often should I come back to make sure that this holds?
Well, everyone's a little bit different, and one of the big things that we want to do is we want to make sure that we can keep you in the good position.
Mm-hmm.
So at the beginning, we check you a little bit more frequently,
Okay.
just so that we're making sure that we're training the body to hold this position. So this is kind of like an orthodontist with braces.
Mm-hmm.
Okay, they put the braces on. Your teeth aren't straight right away. They tweak them a little bit, but in the end, you come in fewer and fewer times. That's the same thing we're doing here, is we're working on the alignment. We get the head and the neck in the proper alignment, and then you come and see us once every 3 to 6 months like you would see your dentist.
Perfect. Okay. Well, thanks a lot. You helped me get my head on straight. And I know we'd like to have you back because you've mentioned so many other things that your procedure can help with.
Absolutely, I love it.
Okay, good. See you then.